Document number 4 is a PDF of our new Type 2 Diabetes Program brochure. The reason why we produced this is because I had a few meetings with educators and with a few doctors, and they said, you know, Steve, we do like to offer our patients all the different options. The thing that they have to be careful about is we cannot endorse any one particular program. However, if you have a letter, or in particular if you have a brochure that we can have in our lobby or to hand them, that would be most helpful. So in your diabetes marketing toolkit, we sent you approximately 100 brochures. We have a few extras for some of the shows that we'll be doing, but those are the brochures for you to bring to these meetings. Now, if you happen to talk to somebody and they want something sent out quickly, my recommendation is write them a quick email, attach this PDF, because it will explain and show what we do. It lists all our locations, it gives client testimonials, and a complete overview of our program. When in a face-to-face meeting, I prepare by putting together a small package for the diabetes educator that I'm meeting with. The next several documents, 5 through 10, should be included in this handout. Print them out, put them in a binder, have a copy for yourself and one for them. This first piece, which we've all seen, is the Why Fitness Together letter. There's 2 pages here, and these are really our talking points and a brief summary of what we're doing. As we explain to them on the phone, why fitness together? Because those people who they see as patients, who have the biggest problems, who've gained the most weight, think about it. Most likely they're the most sedentary people. They've probably done the least amount of activity and exercise. And if they need to go out and do something on their own, they're going to be afraid to do it. They don't know what to do. And they're probably, in all likelihood, not going to do it. That's why they can benefit from a one-on-one program. We then talk about us being the official health and fitness sponsor for the Step Out campaigns. This is really important because of our affiliation with the American Diabetes Association and everything that we're doing with them, including primarily raising money to help find a cure for diabetes. And so far, as of this video, we've raised almost $35,000 towards our $40,000 plus goal. So that's number 1. And number 2, we talk about our type 2 diabetes study. The fact that we're doing a 6-month program, explain to them briefly what it includes, and that we're looking for 1 or 2 participants. Now this is if you happen to be looking for participants for your studio. If you already have them, what I say is, I already have a couple of participants. However, if you have any patients who are, and actually diabetes educators call them clients, if you have any clients that could benefit from this program, tell them that you referred them to me, and I will still offer them a special discount. The next page, which they'll have in their package, is the FT Diabetes Study Guidelines. This very simply outlines the details of our study and the participation requirements. Just be comfortable talking to them about this. We already know what we do with the Fitness Together program. The key things that they need to understand is that we're being coached on how to watch for changes in their blood sugar levels by doing blood glucose checks prior to and after their exercise. And by having our team on the same page, by working with Joan Hill, if there's any adjustments that need to be made, any questions that they have, we have a consultant to work with, and then we communicate directly with their doctors so that they can then make adjustments to their medications. Because as time goes on and people have success with this program, if they're on various medications, in all likelihood, they will need to be adjusted. And that's a good thing, because when people can lower their meds, and hopefully in some cases, when those people are able to get off their medications, and we're going to know after 6 months just how successful we are doing this. Everybody's different. But in the end, we believe that collectively, we're going to show how 40+ people started off at a certain level, and in the end, reduced their body fat, lowered their blood glucose, helped to get themselves reductions of medications, and ultimately save money. And that's really a huge value, not to mention the fact that we're helping to get people healthy who just can't do it on their own. The next document, number 7, is our blood glucose form. And we keep one of these for every one of our study participants. The diabetes educator will look at this and immediately understand what we're doing. They appreciate the fact that we're watching what their blood sugar level is before and afterwards, and then we know what to do in case somebody's blood sugar is low. This next document is very important because it takes data from our clients' initial fitness assessments and the retests that we do every 6 weeks, and as well as our documenting the type of medications they're on, the dosages that they have, and also checking other key elements of their health, like their A1C level. Their A1C level, which gives you an average of their blood sugar level over a 3-month period. So, very simply put, we treat these clients like we do any other. Initial fitness assessment, retests every 6 weeks. We go just one step further. We want to monitor over time how we can see changes, and hopefully positive changes in those numbers, but also to see changes in the use of their medication and hopefully those dosages. The A1C is very important, and that needs to be just recorded once prior to their joining the program. Now, an A1C level might have been taken a month ago, or might be taken in the next week or two when you sign them up. That's fine. Take the closest number and make sure it's verified by their doctor. That level could be any number. It could be 7, 8, 9, 10, 11, whatever that number might be. Record that. At the end of the program, because every 3 months they go back to their doctors, we'll be taking the A1C level closest to the end of a 6-month program. And hopefully we're seeing that being a reduction. That is really the key metric that says that these people were successful with this program. The other document, which we'll review in a minute, is their sense of well-being form. Sense of well-being just says, how did I feel coming into this program? And 6 months later, how do I feel now? And then what we're also asking you to do is record their total number of sessions that they do between fitness assessments. We recognize that people will have an occasional day off. Somebody may be away traveling or on vacation. They're supposed to be coming 3 times a week, but if the average person comes 10 times in a month, that's not terrible. That's probably still pretty good. And also, if they're keeping a nutrition journal, please record whether they are during that time period, just so we can see how they're doing. Once again, the sense of well-being form, which is item number 9 in your toolkit, this is something which also should be included for the diabetes educator. They'll take a look at this, and within 10 seconds of looking at it, it'll be familiar with them. Joan Hill helped us to put together and pull together all these documents. It's what the industry uses when they're doing studies and they're getting patient feedback. This just adds credibility to what we're doing.